Today, we're going to be talking about paid family caregiving. We're going to talk a little bit about some updates and some take action from TJC and TDC. This work is supported by the Special Olympics 2023 Systems Change for Inclusive Health subgrant, and it's funded by the Centers for Disease Control and Prevention. The contents of this webinar are solely the responsibility of the authors and do not necessarily represent the official views of the Centers for Disease Control and Prevention or the Department of Health and Human Services. Today, we're going to talk a little bit about home care in Tennessee, the state of home care in Tennessee, family caregivers and racial equity, paying family caregivers, policy updates, and next steps. And today you're going to be hearing from myself. My name is Vanessa. I'm a staff attorney here at the Tennessee Justice Center. You'll also be hearing from my colleague Jane DeMoby, who is an attorney and EJW legal fellow here at the Tennessee Justice Center. And then you'll probably hear from Jeff Strand, who is from the Tennessee Disability Coalition and is the coordinator of government and external affairs. And for you all to know, this work has been done in collaboration with the Tennessee Justice Center, with the Tennessee Disability Coalition, and Family Voices. So first, we'll start out with some foundation. We're going to talk a little bit about home care in Tennessee, and specifically home care through TennCare. And for folks who may not know, TennCare is Tennessee's Medicaid program. If you have TennCare health insurance, you can get some home care services covered if there is a finding of medical necessity. So basically, your doctor thinks that you need that care, your doctor orders that care, and then insurance will evaluate. This can include nursing services, a home health aide, and personal care services. However, the number of hours you can receive under the TennCare rules are capped. There are some exceptions to this, of course, but those are the exceptions and not the rule. And of course, a medical necessity finding is needed. Children are a little bit more of an exception because they have the protection of early and periodic screening, diagnostic, and treatment, or EPSDT, and this is a federal benefit. And so where children are concerned, if their doctor thinks it's medically necessary, there's more leeway in terms of them getting more services than what is outlined in the TennCare rules. Not only can you get home care services covered through TennCare Medicaid, but you can also get it through some of their long-term services and supports programs. And these programs include Choices, Employment and Community First, or ECF Choices, 1915C HCBS waivers, or the DID waivers, and Katie Beckett waiver. Each of these programs are for different demographic groups in Tennessee. Choices is for individuals who are seniors, 65 and older, or adults, 21 and older, with a physical disability and demonstrate need through a pre-admission evaluation, or PAE. And this is essentially like a medical test that they use to kind of score whether someone needs care and kind of what level of care they need. Then there's ECF Choices, which is for individuals who have intellectual or developmental disabilities. The DID waivers, which are for individuals with intellectual and developmental disabilities who would qualify for placement in an intermediate care facility for individuals with intellectual and developmental disabilities, otherwise known as ICF-IDDs. And the Katie Beckett waiver is for children under the age of 18 with significant disabilities or complex medical needs. Unfortunately, and so these programs are very, very critical to Tennesseans in terms of getting the care that they need to live safely, to live independently in their home or potentially in a facility if that's a better fit for them, and if they choose to live at home in their community and with their loved ones. But unfortunately, AARP, in their 2023 scorecard for long-term services and supports across the country, and this is a scorecard kind of analysis that they do each year. In 2023, Tennessee was ranked in the bottom group, 47 out of 51 in terms of its long-term services and supports. So we have a long way to go in terms of making these programs work for us. And unfortunately, that is made more difficult because of the caregiver crisis. I'm sure many folks on this call know and are aware of the caregiver crisis. And this map kind of illustrates some of those problems. So this is a map of the United States, and it has color-coded areas indicating the supply of personal care aides per 1,000 adults with self-care disability by place of work. And unfortunately, you can see in the red, that is where there are fewer personal care aides per 1,000 adults. And this tends to be concentrated, as this map indicates, in the Southeast. So Tennessee is no exception. But this is a crisis that is felt deeply across the country. Many folks are struggling to staff hospitals, nursing homes, and those who get home care services are unable to find professional caregivers. So unfortunately, that does not mean that the care is not needed. That does not mean that there is a need. So this care, the needed care, tends to fall back on family members. And this is why we're here today, to talk a little bit about that. Unfortunately, again, I'm saying unfortunately quite a bit, it was another analysis in AARP's long-term services and supports state scorecard. And in the scorecard, it found that Tennessee is actually the worst state in all of the country and DC in supporting family caregivers. And this is really important to address because, as we discussed, a lot of the care is falling back on family members because of our caregiver crisis. So I'm going to switch it over to my colleague Jane DeMoby, and she's going to talk a little bit about family caregivers, the impact they have in providing the care, and the racial equity piece in family caregiving.
Thank you, Vanessa. And if you could navigate for me, that would be great. So yeah, just wanted to start off with this quote. I think it really speaks to what Vanessa has so well explained in the last couple of slides. There is a serious need for caregiving. It is inevitable in a way, and just kind of responsibility that a lot of families won't really put aside. So it really speaks to the volume of need. Thanks, Vanessa. So in looking at the picture as a country, like looking nationwide, there are about 53 million people who serve as caregivers. So that's an estimated 1 in 5 individuals that have a full or partial responsibility in caring for their family or community members. It's really hard to overstate how significant that is. 1 in 5 people, and I think again that just goes to how important it is that we have an infrastructure that can support all these people. Looking at Tennessee specifically, there are an estimated 930,000 people who serve as informal caregivers to their family or their loved ones, and that results in about 870 million hours of care annually. Next slide. So why are family caregivers needed? Vanessa spoke to this a little bit and this kind of outlines what a family caregiver does. So delaying or preventing the need for a nursing home or care in a facility is essential. If there is no close family member or community member that can care for someone, usually in the same home, they would have to be placed in a facility. That's very expensive for the state and can be difficult or even traumatic for the person who's put in the facility and for the family members. So allowing a family to stay together and allowing that care to be provided in the home setting is a really huge benefit, not only emotionally, but also financially for states. If a family member can respond to more immediate health needs, that can decrease the need for ER visits or other kind of urgent healthcare interventions, because there's going to be someone at home who can respond if something goes wrong. Going back to what I said earlier, saves the state dollars. And then that kind of has a benefit to the family and to the state if someone doesn't have to be placed in a facility. There's an established relationship, there's a trust between the person who is receiving care and the person providing it. I think that is huge, where some folks can have can find it difficult to rely on what feels like a stranger to provide their very essential needs, and sometimes in very uncomfortable and very personal needs, you know, such as eating, bathing, etc. And overall improving the quality of life for the person who is being supported. Again, seeing a friendly face, seeing a family member, and just being able to know that you trust someone who's taking care of you, and you get to be in the home that maybe you've grown up in, and that you get to remain in the community that is essential to you. So I wanted to just kind of overall share the benefits of having family caregivers, and provide some examples of other things that caregivers do. So the key need for a lot of family caregivers is in assisting in the activities of daily living. That's eating, bathing, getting dressed. Other things that they can do include monitoring their care at home, helping navigate the care system. So making appointments, talking to doctors, making sure that everything is in order. That's a huge task. They advocate for the person who needs care. They manage medications, they provide transportation. So the benefits are super broad. There's so many things that a family caregiver provides, and it just speaks to how essential that person is in the overall picture of providing support to someone who needs it. Next slide. So that comes with some struggles. There are three main ways we can think about family caregiving struggles for a family caregiver. Physical costs, so taking a toll on the body; emotional costs, which is a significant mental health toll; and then financial costs. So those financial costs are tied to both out-of-pocket costs and some other things that we'll discuss. So physical costs. A common issue that family caregivers report is a lack of sleep and being overworked. So this comes from, you know, working a full-time job potentially, and then also caring for someone all the other hours that you're free. That could mean working two jobs to make ends meet on top of caring for a family member. And also caregivers are simply short on time, so they might even put aside their own health needs if it means that they'll be able to spend more time taking care of their family members who some might feel need it more. So there's a significant physical toll that can come from the family caregiving responsibility that folks will take on. I also wanted to point out the mental health toll. So not only is there a significant amount of stress that just comes with managing someone else's health on top of your own, the folks are often taking care of their home life, maybe other children, and working a full-time job. There's a lot of pressures that tend to compound when someone is in a family caregiver role. And then the financial costs. The people who are caregivers often experience a loss of wages related to caregivers. So that's one thing. They'll pick low-paying jobs because they might have some flexibility. They'll cut their hours in most of their roles. They might be at high risk of getting fired because of how often they might need to switch between working and taking care of their family members. Or they might switch jobs frequently because they just can't find a good fit with a hectic schedule. But not only are people experiencing loss of wages related to caregiving, they may also have to pay out-of-pocket costs when it comes to caregiving. So this can include paying for medication that if needed, and maybe there's an issue with it not being covered. This can be for random equipment, or maybe just improving the house to ensure that the person who needs to live at home can actually live at home. There are just a various out-of-pocket costs that come with the list of caregiving responsibilities that we just discussed. And then this is also where the equity lens comes in, specifically social determinants of health. So social determinants of health are the non-medical factors that influence health outcomes and someone's quality of life. This can be education, your neighborhood or your environment, your income, and more factors. Low-income people and people of color already have a closer proximity to the social determinants of health factors that lead to worse health outcomes overall. So the health disparities already exist. We're just now going to apply them in the family caregiver context and talk about how if someone is already struggling with their own health or their own finances, or they have a lack of education, it can make navigating these systems so much harder and lead to disparities in family caregiving outcomes. Next slide. Yes, the prevalence of caregiving. Yes, thank you. So the prevalence of caregiving overall, this is just a really helpful picture. So if you look here at the numbers of caregiving, the prevalence of caregiving within different communities, you'll see that in Black communities, there tends to be the highest prevalence of people identifying as a caregiver and stepping into a caregiver role. And that's about 28.1%. And comparatively, the percentages in other groups are lower. So for the Latino population, the prevalence is 21.9%, and then it's slightly lower in the white and Asian AAPI, Asian American and Pacific Islander communities. These numbers are according to the National Alliance for Caregiving, which produces a report on the picture of caregiving every 5 years or so. And they were able to survey a large number of people and get a very clear picture of who is serving as a caregiver and what does that mean. So this is just a quick look at the disparities in caregiving and the prevalence of caregiving in different communities, so we can see where that burden is falling. And this doesn't speak to the individual burden, but just how it plays out in a community as a whole. Yeah, so hours of care. This ties really closely to what we just discussed. Black caregivers reported providing an average of 31.2 hours of care, while Latino caregivers reported about 26 hours of care on average. Asian American and white caregivers reported, Asian American caregivers reported 24.1%, and white caregivers reported 24.1 hours, and white caregivers reported 21.2 hours. This is really interesting. If we parse this out, this picture again is really essential to think about. That 31.2 hours that Black caregivers are reported to provide is just on caregiving tasks. That's not, that doesn't include the amount of time you spend on work and other life management. So whether you're spending 20 hours on caregiving or 30 hours on caregiving, the burden across the groups are clear. And then you can also see how they differ. Next slide. Yes, so intensity of care. So this is also really, really interesting. When there are different types of caregiving tasks. I mentioned earlier the activities of daily living, eating, bathing, getting dressed, etc. And then other tasks like managing medications, making appointments, and ensuring that the healthcare, the person in need is getting the healthcare that the person is getting the healthcare that they need. But there are also specific nursing tasks that come with caregiving. So this is like giving medicines, managing pills, and maybe even giving injections. So you're actually administering care to the person. These are seen as slightly more intense caregiving tasks, and there is a disparity in the prevalence of that as well. So Black and Latino caregivers reported an average of 67% of Black and Latino caregivers reported helping with medical or nursing tasks. And compared to white caregivers who reported about 52%. So this kind of speaks to the reason that someone would step in for these tasks is if there is a caregiver shortage and there isn't someone available to do that. So we see this kind of shows us where the concentration of the caregiver shortage might be because it correlates with who needs to step in. And we see that Black and Latino populations tend to take on those medical and nursing tasks more frequently. Other research shows that a different type of care, there are also disparities in a different type of care, high intensity caregiving tasks. So these are sometimes medical or nursing tasks, but really these are speaking to things that have a significant physical strain. So lifting, carrying repeatedly, or other things that have to be done frequently to ensure someone is in the best care environment. So cleaning medical equipment, restocking, things like that, where if you have to do that and it takes up a lot of time, these are seen as high intensity caregiving tasks. And we see that 54% of Black caregivers and 49% of Latino caregivers tend to provide these high intensity caregiving tasks, while 35% of white caregivers and 32% of Asian caregivers provide those same tasks. So we can kind of see a difference in that as well. Finally, we could talk about the economic impacts of caregiving. So, this is really one of the more significant areas where we can see the toll that caregiving takes. So out-of-pocket costs, like I explained earlier, and a major one is taking on debt or not being able to save. So if your employment is unstable or you're constantly having expenses that you need to things that you need to purchase for either the home or for the person who needs care, it really adds up, and eventually people see themselves taking on mountains of debt and just overall not being able to save over a very long period of time. Similarly, folks will use up their savings, have to pick and choose which bills to pay if they even can, or they end up borrowing money from their families or friends just to make ends meet. So going back on some of this, the impact on quitting, the impact of quitting your job is really, really significant. So that was the look at what the economic impacts are, and now we can see how they look. So Black caregivers experienced about 55% about 55% of Black caregivers reported experiencing any financial impact compared to white caregivers, which were about 42%. If we're looking at what folks ended up reporting, most often Black caregivers report that they stopped saving or that they didn't pay their bills. And then if we look at the actual financial impacts, you'll see that the most financial impacts were concentrated, an average of 2.4 financial impacts. That means an average of 2.4 major financial issues were reported within the Black caregivers who responded to the survey, compared to 2 financial impacts among the Latino population, and then 1.5 in the Asian American population, and then 1.4 in the white population. So we can see that there are more concentrated financial impacts in Black communities. I just wanted to wrap up by saying a lot of these the things that we're discussing, which is the burden of the caregiving, the intensity of the caregiving, and the economic impact of the caregiving, do track social determinants of health. And so the communities that are already overburdened tend to then, that tends to extend into caregiving, which results in some of these numbers that we're seeing. And again, this information is on a national scale, so we have no reason to believe that there is a difference in Tennessee, but additional studies do need to be done about how caregiving disparities exist in Tennessee. Thanks, Vanessa.
Thank you so much, Jean. And actually, Jean is going to be publishing a paper on our website that kind of provides an overview of some of the things that she talked about. So if anyone wants to have a reference there, that will be available. And of course, we're going to share our slides so you guys have it. I know it doesn't kind of get into the specifics around the numbers, so the paper might be more helpful there. So now we're going to talk a little bit about paying family caregivers as a tool to address some of these burdens that family caregivers face. As Kimberly Taylor mentioned, being a family caregiver can be the hardest job you will ever have. And so paying family caregivers is one tool. There's going to be so many things that need to support family caregivers, but paying family caregivers is thought to be perhaps one tool to provide at least some financial relief to family caregivers. So how states pay family caregivers. This is kind of an outline that Jeff has provided. He's way more articulate about this than I am, but essentially there are 4 buckets of payment models. There's standalone programs, and we kind of look to Georgia as an example there. There's consumer direction, which a majority of states utilize, and we actually also have a version of consumer direction. And then there's an agency-directed model, which we look to Oregon. There's also a mixed bag where people kind of, where states, excuse me, kind of pick and choose some things that work for them. States that pay family caregivers kind of proactively have some kind of way or path forward for families to be paid, family caregivers to be paid, are varied across the country. This is a map that Jeff also whipped up, and it was as of 2023, I believe. And this is specifically for folks with individual intellectual and developmental disabilities. And as you can see, Jeff points out that Tennessee is a bit weird. And there are 18 states that allowed payment and 9 states that temporarily allowed payment. For folks who are 65 and older and or have a physical disability, 18 states had payment options, 7 states had temporarily permitted payment, and again, Tennessee is weird. And part of why Tennessee is weird is, so here are some of the kind of paths that Tennessee has right now that are not really explicit or proactive or kind of work for family members. So Tennessee did engage with some COVID flexibility. So during COVID, as everyone experienced, we were on lockdown, so folks could not get to work and interact with the community. And so recognizing that, there was an option for states to pay family caregivers, and Tennessee did utilize some of those flexibilities along with many other states. Because of course, even through COVID, we need to support folks who need that support. There's also a way that family caregivers can get paid. This is kind of not direct payment, and it is not within the Medicaid programs, policies and procedure, but providers are able to hire family members to provide care. Now, this is dependent heavily on the provider, whether their policy allows that. They're, oftentimes private company, so they have their own internal policies on that. And historically, this was actually quite discouraged from TennCare. But there has been some changes and potentially will be more changes. And Jeff will talk a little bit more about that in terms of some of the changes we saw in this past session, this legislative session. And we're hopeful that there may be some policy practice changes there. However, getting hired by a provider has a lot of barriers in and of itself, and also just doesn't work for a lot of family caregivers. However, this is one way that family members can get paid. It's, again, not a proactive policy or incorporated in TennCare rules. Now, consumer direction, it is some way that family members can get paid that is kind of carved out in TennCare rules. However, there's a lot of barriers to actually being able to access consumer direction. There has been a lot of issues so they have kind of a separate company that does kind of the payment processing, and there's been a lot of barriers there. And more significantly, the rules for consumer direction explicitly exclude certain family members, and those that live in the home with the person who's being supported from being paid through consumer direction. So as you can see, Tennessee is weird. We have some kind of fuzzy ways that folks can get paid for the hours of care that they provide, but it's not really done with intentionality and a thought process to make sure that family caregivers are supported in Tennessee. I will also mention that particularly in ECF choices, you can get a family stipend, but the stipend has proven to be, based on feedback from folks that we've worked with, very, very inadequate. And also and so I'm gonna, so what should Tennessee's model be? So our first step, in collaboration with Family Voices and Tennessee Disability Coalition, was to open the path for conversation. And that is kind of what we've been focusing on this past year, and have had some successes that Jeff will kind of touch upon. But then really the hard work is going to begin. We're going to have to really think about what works, what the state is able to kind of achieve. And the key thing is that stakeholders, particularly family caregivers, must be at the table and advocate that they are at the table, which is what we're hoping to support and achieve. So I'm going to go ahead and pass this over to Jeff, who's going to talk a little bit about some policy updates and next steps.
Yeah, thanks, Vanessa. Sorry I'm late. I lost track of time deep in citing sources for a different paper. But I'm glad to be here, and I'm glad to see that so many people are here. This year was a pretty big year for paying family caregivers in Tennessee compared to instances in the last decade or so. There were two pieces of legislation, one a resolution, one a bill. I'll start with the bill here that were introduced this year, kind of compared to zero in previous years. So this was one that flew under the radar, and we didn't know about it until we saw it in committee. This was a bill from Representative Parkinson and Senator Briggs. Parkinson really led the way on this. He had a constituent reach out to him who mentioned how difficult it is to find caregivers to, subsist as a family caregiver. I want to highlight Lynn's comment here that there are too many barriers, so people give up trying. That's exactly what this was trying to get at right here. So we talked about how explicit bans on family caregivers living in the household don't exist with Tennessee, but they are implicit bans. Only in the most unique of circumstance will TennCare support an individual, a caregiver, in finding a way to get paid. And in almost all instances, they'll throw up barriers trying to get people to give up. And so what this was getting at was codifying the explicit non-ban. So when we were sitting in committee, we were in the health committee on the House side. TennCare showed up to say, well, actually, we don't need this legislation because you can already get paid to be a family caregiver. We don't have a ban on that. And so I thought Representative Parkinson was really apt when he said, well, that's great. Let's put it in the law then. And that's exactly what this does. Is it so the law says TennCare cannot explicitly prohibit the payment of to family caregivers based on where they live. Because that was the general understanding and the general way that people had been denied access to payments or any sort of comprehensive program, was that they lived in the same house. And those were considered, and I've come to find over the last year that this is considered a pejorative by a lot of family caregivers, but natural supports, in that it's sort of insulting that you're expected to provide these things with no help or no support. And then TennCare does not pick up their side of the slack and provide formal paid caregiving. So this one did not see a bunch of opposition. TennCare did get their claws into it and really, really water it down. So we can see not ineligible to receive payment on the basis of where you live, but this does not apply to CLS service, so community living supports. And that is pretty much what DSPs do. So that's like home health care, that's personal assistance, that's community integration supports. That's pretty much all those things. But the big important part of getting this one in there is it is now codified. And it gave us the opportunity to go through and talk to everybody at the legislature about how important this is and how sort of weird Tennessee is in the fact that it's not explicitly banned, but it's implicitly banned. So as you can see here, is our hope is that TennCare takes this very seriously, not just in the letter of the law, but the spirit of the law as well. As you can see, I'm not holding my breath that they will, stick by the spirit of this law, but there are still huge barriers that are not going to make this a comprehensive, accessible, functional program for family caregivers to get paid. And so while it's important and while it, opened the door to have a conversation at Cordell Hall, it hasn't changed things substantially. I see there's a couple questions here. It's frustrating, speak up system, which is extremely frustrating. It's kind of the idea, is to frustrate folks into, like you said before, giving up. The law will go into effect. It's either upon passage, so it's already in effect, or it'll be July 1st. That is typically how these go. I'm not quite sure. We do know that TennCare has to promulgate rules on this, and that's where they'll ban those community living supports from being eligible for this part right here. And so I'll go into one that we worked on here. And so this was with TJC and Family Voices, kind of our kickoff to having a year of conversations around how important this is, how difficult it is to be a family caregiver in Tennessee, and how little the state is offering any help. So Senator Yeager was our prime sponsor. Our House prime sponsor was Representative Robert Stevens. And this is a resolution. And so backing up really quick for a little Civics 101, a law, passing a bill into a law means the state has to do something or somebody has to do something. A resolution is more like a sentiment. When you pass a resolution, it means that the General Assembly thinks this. And so this one says, we, the General Assembly, think that the state should develop a comprehensive statewide paid family caregiving policy and program in collaboration with consumers, stakeholders, and advocates by January 2025 to support family caregivers in the state of Tennessee. And so how this worked is it looks a lot like a bill. It goes through all the committees. We had an opportunity to discuss in committees. Yes, and I missed that part. Representative Doggett signed on in the end because he's very interested in this. He had long been, like Representative Stevens, Senator Yeager, a supporter of the disability community and an important ally at Cordell Hall. But this was a message that we're sending right here. It gave us the opportunity to talk to legislators about it, both in their office and in committee. It gave folks who came down, advocates like for Disability Day on the Hill, and those that came down on their own, something to point at and talk to. And, it's a jumping off point for these conversations. So now our legislators know, all of them that will be coming back next year after the elections, that this is an important priority for the disability community. And TennCare has this stance. We've already educated that, it's an implicit ban, not an explicit ban. And so the goal was to pass it. The goal was to have the conversation. The goal was to put the pressure on TennCare to either agree and comply with the sentiment of the General Assembly or open the door for us to say, if TennCare is not going to do it themselves, General Assembly, legislators, you need to tell them to do it. And that's what our plan is next year. Will TennCare be swayed? You know, we can put pressure on them, and we'll provide opportunities to put pressure on them. I'll give you the email of folks to prod and push and bother, say, when's this coming through? When are you going to abide by this resolution? But I don't believe that TennCare is going to take this opportunity to enact the sentiment of the General Assembly. So where that takes us is the ongoing advocacy effort. So this started last fall with the Tennessee Justice Center and Family Voices and the Disability Coalition. We got together and said, let's take 2 years and really work on this and get something passed. And so last year was that opportunity to talk about it, provide materials, pass the resolution. And then the idea is to put pressure on the state this summer and say, hey, this has been passed. What are you going to do about it? And should they so decide that they do not agree with the General Assembly, we will spend the next, 6 months, 7 months leading up to the session, putting pressure on TennCare, putting pressure on DIDD, putting pressure on, honestly, our legislators to go out there and fight for family caregivers. And like Vanessa had mentioned before, like Jane mentioned before, this is not a silver bullet, and we're not going to portray it as a silver bullet, but it is an arrow in the quill. It is something that helps, and something in the absence of everything is really important. So a couple things that you can do to join us. You can check out our Paid Family Caregiving Resource Hub. That's where you'll find opportunities over the summer to reach out to your legislators. If you would like to share your story, and this is super important, because the best way that we're going to be able to advocate for this at the legislature is to put a human face to how difficult it is to be a family caregiver, and how much a payment would mean, how much it would mean from the state, how much it would mean to a family, right? And so you can email those stories to Ashley Bell Siebers. She's the director of Family Voices, and let them know. And I'll tell you that when we come time next year to be pushing this, so thinking about already January, February, March next year, thinking about coming down to the legislature, putting your story into a little video and sending it to your legislators, and maybe participating in Disability Day on the Hill, but continuing that drumbeat from the fall and from the resolution over the summer and through the fall to make sure that TennCare, DIDD, and our legislators know that we haven't forgotten this is going to be really, really important. So if you have got questions on this, please feel free to reach out to me. That's my email right there. We still have a lot of work to do in constructing what we want our policy to look like, because the most important thing here is that this works for Tennessee families, right? There's no point in passing something that TennCare can muck up and make inoperable. And TennCare is fantastic at mucking stuff up and frustrating folks into stopping trying to access things they're entitled to. So we're going to want a lot of help from the community to help us design this so that we know that it works. And then we're going to need a lot of help to get it up over that political feasibility bar. Are we going to be able to go into offices and have a strong argument for the very specific policy that we put into place? A lot of work over the next 7 months or so to get ready for the legislature to reconvene, and then plenty of work during the General Assembly session. And so I'll take a look at some of the questions here. What is the estimate of cost for TennCare to do this? It sort of depends on the design. If we're asking for a standalone program, they're going to ask for the moon. They're going to ask for 30 employees to run this and a $10 million IT upgrade. That it's kind of their MO, is that they don't want to do it, and you give them the opportunity, they are going to pump up the cost and make it really difficult for it to get into the budget. So in my opinion, if someone has 24 hours of personal assistance in their independent support plan, and the state can only provide 10 hours, they have set aside money for 24 hours. So those 14 hours, the payment for that could go right to that family member, and it shouldn't cost a dime, in my opinion. TennCare is not going to have the same opinion. I need to taken care of, so I'm interested to go to your website. Yeah, check out the website. It needs to be updated a little bit since the end of the session, but that's where we're going to keep offering up these opportunities. Want legislation for next year, we need to get sponsors and draft bills starting August, September at the latest. That's right. We have legislators who are interested in supporting this effort. We'll definitely need folks, their constituents, to go down and tell them that, no, we want you to do that. And how do other states make it happen? Why are we last? You know, I ask that every day in this job. I mean, how many times I've gone into legislators' offices and say 46 other states have this, 45. When the Katie Beckett program passed, they said 49 other states have this. So catching up and keeping up with the Joneses is its own argument as well. So keeping that in mind. All right. I think that's my last slide, Vanessa. Turn it back
Yes.
over to you.
Yes, so I'm gonna go ahead and stop our recording. And so